I love doing little home glucose tolerance tests with a CGM. So to do your little home, mothers who replaced choline, their babies were much more focused. They could focus in and learn much faster. If you have an ApoE4 allele and you have a higher risk of early dementia, then what should you be doing? So I do think there's a point where joint replacement does make sense. It's kind of one of our passions is this whole question about cholesterol and when to use cholesterol lowering medication. Chronic pain.
Welcome to our Q&A highlights. Q&A sessions are recorded every month, and our enhanced members get an exclusive opportunity to ask questions from one of cellular medicine's brightest minds, Dr. Elizabeth Yurth. Get a chance to ask your questions by becoming our enhanced member at bli.academy/memberships. You also get access to our content library full of tips, articles, videos, lectures, previous live Q&A sessions, and more.
It's kind of one of our passions is this whole question about cholesterol and when to use cholesterol lowering medication. So unlike a lot of doctors who are either very, very passionately for their drugs or very, very passionately against these drugs, like I don't use any pharmaceuticals, that's ridiculous, statins are all evil and they come from Satan, or statins are, straight from God. I'm gonna say that there's nothing I feel that way about. I find that there is a usefulness to almost everything. And so I'm not going to say these are horrible or they are great. They have a purpose, but they are overused. What we know is the longevity data supports that having a cholesterol somewhere in the 200 to 250 range is optimal. And in fact, cholesterol itself probably is not a big deal, but you need to look at the other risk factors. So we now have ample evidence to show that ApoB is a much, much, much clearer marker of cardiovascular risk than total cholesterol or LDL cholesterol is. There's a lot of debate whether it's just ApoB or whether the BA ratio is the most important thing. It makes sense that the BA ratio is probably more important. So we want a low ApoB, a high ApoA. We want that ratio less than 0.6. But I think if you have a very high ApoB, like you're in the 135, 145 kind of range, probably it behooves you to address it and try to bring it down. So I will use cholesterol lowering drugs in those people. It's always better to have insulin measurements, but I love doing little home glucose tolerance tests with a CGM. So to do your little home CGM test, what you would do is eat for about 3 days, just eat whatever your regular diet is, whether that's bad, whether that's good, whatever you usually eat. And then you want to fast for about 8 hours. So fasting, you can't have water, you can't have black tea with nothing in it, not black tea, just tea, or black coffee with nothing in it. So those would all be in your fast, but zero sugar, zero cream. Don't take a bite of something. Don't say, oh, I'll have just a little bit of creamer in it. And then you test your blood glucose. And I'm in a fasted state. I feel my blood glucose 75, whatever it might be, right? And now what I'm going to do is drink something that has a big glucose load. So you want about 75 grams of glucose. So you can do that by eating 10 jelly beans. You can do that by drinking a big thing of orange juice. So you just want to do a big glucose load, ideally about 75 grams of glucose, okay? Or you can buy glucose tablets. You can use it that way if you want to dissolve glucose tablets into something and drink that so you know you have exactly 75 grams, but somewhere close to 75 grams of glucose. And you want to do that as quickly as you can. Don't eat some big ice cream bowl because that takes too long to digest. You want to do something quick like juice or a quick dissolved glucose tablet. And then you want to retest your glucose at 1 hour and at 2 hours, okay? And what you really would like to see is your glucose come back to baseline pretty quickly. But if it goes high longer than two, so at 1 hour, it's probably going to be still up. If it's still high at 2 hours, that's a problem. You should restore to normal at that 2 hours. So I should get back pretty close. Maybe not exactly, but if I started at 75, somewhere, 80, 85, 90, fine. But you want to see it come back to normal. That meant I have a normal insulin response, brought my glucose down nicely. Okay. If you do your test and at 2 hours, you're at 55, it means you had an over response to insulin, like surged in, right? You had too much insulin response. But most of the time what you find is people are high. They're just not getting, their body's not responding well to the insulin. That's insulin resistance. So it's a nice little test you can do, and you can do it kind of frequently and easily to sort of see what's going on with your body. If you have an Alzheimer's history, so let's say you have an ApoE4 gene, either a 4-4 or a 3-4 or a 2-4, but you have an ApoE4 allele, and you have a higher risk of early dementia, then what should you be doing? So in my patients who are ApoE4, especially if they're 4-4s, because their likelihood of developing dementia is very high, then I'm going to make sure that they are doing a lot of preventative things, probably quarterly getting cerebral lysine IV infusions. Maybe I'll put them on a couple times a year humanin. Humanin is really helpful. It's a mitochondrial peptide that was really called humanin because it brought back the human to demented patients. So it's a really nice option to prevent that brain loss that we see with dementia. So I might use those tools. Remember, the number one thing you can do for your brain, whether you have dementia, whether you're trying to prevent dementia, is exercise. Bar none. It is much better than any expensive pill they've come out with. The improvement and the lack of progression that you'll see in cognitive decline people when you get them into a regular exercise program is dramatic. And then following a diet that's very low in processed foods, you want to get rid of sugar, you want to get rid of the bad carbs, some fibrous carbs, vegetables, eating fermented foods and fiber foods, important. I like krill oil for preventing any kind of cognitive loss, and I like plasmalogens. So, do you need plasmalogens at 40? Maybe. Depends on what your levels are, what your genetics are. So might not be a bad idea to get tested with a prodrome scan and know, do you need some plasmalogens? Are we seeing breakdown of myelin? We're seeing loss of myelin, loss of sphingomyelin. And then we probably want to replace some of those base lipids. So we can look at all those things and decide what we need. What is inflammation? Chronic inflammation is a prolonged abnormal immune response that occurs when the body's inflammatory processes don't end like it should. So inflammation is good, right? I get hurt, I get sick, I need inflammation. But then the inflammation should go away and anti-inflammation starts. It's when our body doesn't shut off that inflammation, that stays up, the anti-inflammatory piece doesn't come into play, then inflammation becomes chronic. So it is always a dysregulated immune system with a prolonged cytokine response, could be different cytokines, but a prolonged abnormal cytokine response that the body thinks there's still some threat when there's really not a threat anymore, and it goes into attack mode. And that happens to our immune systems as we age. So it's one of the big things. That's what inflammaging is, right? It's a dysfunction of the immune system. All of us start to get dysfunction of the immune system. That's why we use thymic peptides. We try and do things, try and keep our immune systems healthy. Fawn asked, if I'm doing a 1-day water fast, is it better to do it the day before taking rapamycin, the same day, or the day after taking rapamycin? What about a 2 to 3 day fast? You really want that day after rapamycin or the day after a fast to be a rebuild day. So you wouldn't want to fast after doing rapamycin necessarily. It would be better to do it, if you're going to do a 2 to 3 day fast, to do it the 2 days or 3 days before rapamycin. And if you're doing 1 day fast, I would do it the day of rapamycin. Also, if you're doing a really hard exercise workout, right? You're doing a big muscle building workout, then when you're on rapamycin, you are inhibiting mTOR, mammalian target of rapamycin. And when you inhibit mTOR, it is harder to form muscle. So remember that, because that might be a day when you want to do something that's a little gentler and not such a big muscle building force type exercise. So I think that using the fasting around the rapamycin is fine if you want to do that, and use the next day to kind of do your rebuilds afterwards. So you can have bone-on-bone arthritis and no inflammation and no pain. So you really want to treat pain, not the fact that you have bone-on-bone arthritis. If you have bone-on-bone arthritis and we can't get pain under control using things like pentacin, BPC, TB4, and maybe we've tried, a little bit of regenerative procedure, it may be that you are too far gone. I think joint replacements at that stage. I just have a young patient, who's, in her early 50s, who just had her hips replaced, super athletic, and she's thrilled. She's finally feeling like she can hike again and do things. And, and she tried everything and it just wasn't enough for her. So I do think there's a point where joint replacement does make sense, but I would make sure that you've tried getting all the inflammation down and done all the other things before you go there, especially if you're younger. I think one of the things we are overlooking a lot in treating pain is the mitochondria. I believe mitochondria are the root of almost all disease. And there's a lot of evidence that chronic pain syndromes are very linked to mitochondrial dysfunction, including neuropathies, radiculopathies, fibromyalgia, most definitely linked to mitochondrial. In fact, when they look at people who have true mitochondrial diseases, so you look at all these, host of mitochondrial disorders that people are born with, 70% of those people have chronic pain syndrome. So we know that if your mitochondria aren't working well, you have chronic pain syndrome. So if you have a chronic pain syndrome, likely your mitochondria aren't working well. Remember, neurons have a really high energy demand in comparison to all other cell types. So they need a lot of ATP. So if my mitochondria aren't working well, and they're my main source of ATP, it stands to reason that my neurons are not being supplied with enough energy, and they're going to rebel. They're going to send out weird signals, right? They're going to send out weird messages. Most of that is interpreted to our brain as pain. So the strange messages because they disturb neurons. And again, this is not just in neuropathies, it's in things like joint pain. We know that joint pain is very linked to something called neural growth factor. So these abnormal nerves that grow into the joints that are sending pain messages, that is truly also related to mitochondrial dysfunction. Number one, besides your good multivitamin with folate, methylated B12, vitamin B6, you know those ones. Choline. Choline is critical. And I don't hear doctors tell their women who are, or men who are working on getting pregnant or getting close to that choline is so critical. It's super interesting is that when they did a study on mothers who replaced choline, their babies were much more focused. They could focus in and learn much faster. So the skill set was much ahead, and they had much lower levels as they got into school of ADD. So choline replacement in the mother prevented ADD in the child. So and the recommendation is 450 milligrams, way too low. You want 3 times that much. You want at least a gram of choline, okay? And that's while you're pregnant. That's before pregnancy, while you're pregnant, while you're nursing, lots of choline. I think you can never get too much choline. Eat a lot of egg yolks too. Creatine also. Nobody here talks about creatine, right? Super beneficial because creatine is cellular energy metabolism, and that's essential for sperm motility. It's essential for the placenta to form, for the endometrial lining and the developing baby. So it really helps a lot when people are on creatine. There's a lot less injury to the baby during birth. So you see a lot less brachial plexopathies and things like that during birth when the mother takes creatine. And the father, it really helps with sperm motility. Plasmalogens, I think, are key. They're really key to brain development and neural development. So lots of plasmalogens for both mom and dad, very key. Zinc for men, obviously D3, K2, krill oil. You want to make sure you do mitochondrial support. Mitochondria, again, especially for sperm motility. And the mom, mitochondria all come from your mother, right? So if you have a mitochondrial problem, blame your mom because the dad doesn't give the mitochondrial genome, only the mother does.